On and Kareem, I see you're here too.
To share my screen. Can you see the screen, Jennifer?
Yes, we can see the screen.
Okay. So I am just letting
Letting folks in.
in.
All right, Kenitra, do you want to start or do we want to
Yeah,
get
let's
started?
let's get started. Yeah.
Okay, well, good afternoon, everyone. I'm Jennifer White Holland, have the pleasure of serving as the Policy and Community Engagement Director at the Horizon Foundation. And I am here joined by my colleague Kenitra Fuqua, if you'd like to introduce yourself, and baby Riley, too. I'm sorry, acknowledge
Yes.
you
I was
as
gonna
well.
say you forgot the most
I do.
important person. Good afternoon, everyone. I'm Kenitra Fokwa with the foundation, oversee all of our grant making. So Jennifer and I are just gonna tag team today and go through the RFP opportunity with you.
Okay. All right. And so the foundation, we are so very
Sorry, sorry,
pleased.
sorry, sorry.
Oh, we're going really fast.
Okay, there we
With the
go. Sorry.
foundation, we are so very pleased to launch our Birth Justice RFP very quickly. Wanting to for our time, we will not just walk through the RFP, but we will also provide a brief background of how we got here, and wanted to also uplift our vision and our mission as an organization. By way of background, in 2023, we conducted a comprehensive strategic plan. We did deep listening in the community through polling, through focus groups, both in English and Spanish. We knocked on doors and did a canvas across Howard County. We conducted one-on-one interviews, and we even expanded our program and an evaluation committee as part of our board to include to community members to ensure that we were in tune with and could better understand what some of the needs are in the community and how might Howard County residents want their community health foundation to best serve and meet their needs. And so, as part of that strategic planning process, that really anchored ourselves in a co-creation sort of process and model to ensure that we are leaning into being anti-racist as well as trust-centered philanthropy. We have again created a new vision, a new mission for our organization. And if you move to the next slide, you will see our new values even as well, ensuring that we are leaning into what it means to be impactful, trustworthy, anti-racist, as I said, courageous, and catalytic. And so we are truly not that it is a light switch where we say these words and then become it, but we have been on an intentional journey to ensure that we are leaning into these values, this new vision, this new mission, to really challenge ourselves and do the internal work to really advance racial equity and to lean upon those who have the lived experience paired with research and data to help drive the policy and systems change that we need to see to address the health disparities and inequities that we all see and experience. And so if we go to our next slide, these are our new focus areas. For those of you that are familiar with the foundation, some of these areas are not new, such like mental health or health coverage and care, and even food and nutrition, along with our work and experience in doing power building and organizing and advocacy. But what is new in some of the work that we've done has been around maternal and infant health. Grandma's here now, so let her get her time. And so we are very excited to launch this new initiative. But our work, we have some history in doing this work. And so if we move to the next slide, I'd like to offer a definition that we are anchoring ourselves that serves as a foundation for us to be held accountable, as well as ensuring that we are using and leaning upon the work that has been carried out in community. And if anything, we applaud and acknowledge the work of Black women who continue to shoulder and do this work using birth justice and reproductive justice frameworks to ensure that our work is reflective of that and constantly ensuring that we are reflecting ourselves back in the mirror, looking at ourselves in the mirror to see how we are living those values out loud, but also holding ourselves accountable when it comes to this definition that looks at a birth justice as a human right, as well as ensuring that we are creating and have access to holistic and culturally centered healthcare. And again, looking across the entire sort of spectrum during childbirthing years and what have you. And again, acknowledging the work that Black Mamas Matter Alliance and many others within this arc and the work that has been done in this space. And so while we might be new to this space, we certainly are continuing to learn and lean upon those who have been doing this work for a long time. And so if we move to the next slide, I would like to elevate some of the work that we've done over the last few years that has brought us to this point. And it started with some of our work that we've done with CASA in partnering with Howard County General Hospital, as well as Chase Brexton, to create a maternity partnership program and securing monies in the Howard County budget. And so we've been very pleased to see that program be established. And we know, as some of you may know, that there's some work to do in making sure that before the Healthy Babies Equity Act passed in 2023, that this was an opportunity for us to ensure that those who were uninsured had a way to receive prenatal care instead of going to Baltimore City or even Glen Burnie for their care. And so we're very pleased to partner with CASA back in 2021 that launched our work in that particular space. In addition, we advocated for the passage and implementation of Healthy Babies Equity Act back in 2022 and 2023, building relationships with partners like Planned Parenthood of Maryland, where we are continuing to work with them to ensure that we can establish a reproductive health clinic in Howard County. And so we're delighted to see that work move forward, and hopefully we'll see how that progresses even this year. And then in 2023 through 2024, we have been having conversations with some of our sister philanthropic organizations to explore the creation of a birth equity funders collaborative. And so that allowed us to have a maternal health landscape being conducted so we can have a sense of what are some of the needs, the opportunities, who are some of the key perspectives and voices in this space so we can continue to build and maintain relationships with those individuals. And so while the funders may not be ready to pool funding or even have I would say, to co-fund organizations. I would say, though, that that process really opened up our eyes to what the needs are. And so we're ready, which is why we are launching this particular birth justice initiative to ensure that we can invest and put forth a good foothold in this particular space and to build and work with organizations like yourselves. And then in 2024 and 2025, this really, if anything, catapulted us into where we are now. And so we created a maternal health work group to then identify local and state policy opportunities and strategic areas of investment, which helped us to really define this RFP. I'll share a little bit more um, about the uh, about the work group itself. But then we also were able to take a deeper look at some of the working definitions that we are to use or we would like to use in this space to better ground ourselves in this work. So on the next slide, um, you will see our priorities. And as I mentioned before, we had a maternal health work group that brought together midwives, doulas, OBGYNs, public health professionals, our local health department, representatives. We had researchers. We had mamas, grandmamas, organizers. We had a variety of perspective and people around the table that helped us to identify opportunities that then translated into these specific priorities, which are a part of this RFP. And that, if anything, and I would say that the most important thing that we acknowledge is the need to really transform and really turn upside down our systems and institutions that unfortunately continue to perpetuate harm to mamas in our community. And we recognize the need to make that change. We need to have a collaborative advocacy effort to ensure that we are uh, building our advocacy and organizing muscle amongst this particular space and advocates, and to position ourselves to make those funding asks at both a local and state level, as well as pushing and fighting for policies that we need to see changed at those levels as well. And that, if anything, undergirds the other priorities that we've listed here. And so the other opportunities that we have within this RFP relate to community supports in Howard County, and that can look very differently. I think a number of you, I'm familiar with some of your work that are here on the call. Some of your work is reflective of that as well. Many of you are also birth workers. And so we recognize the need, and through our maternal health landscape and through the work of our maternal health work group, recognize the importance of strengthening and supporting the pipeline of birth workers through training, education, and advocacy. And then finally, examining our institutional systems and processes to ensure that we are creating and sustaining a harmonious birthing environment. And so you will see that these are the large bucket sort of priorities. We are not prescribing what that looks like. I think the joys in this entire RFP and through our strategic planning process has been a commitment to co-creation. And so our goal is to work with you and for you to also share your ideas, your experiences to help speak to these buckets and these priorities, and recognizing that advocacy at the center of it is advocacy, but recognizing that there will be other opportunities to elevate your work, and also to support others as we really strengthen perinatal health in Howard County. So I'll turn it over to Kenitra to share a little bit more about this grant opportunity as well as its commitments.
Sure. So for this grant opportunity, we are expecting to fund at least five organizations for up to $30,000. So each to just engage partners in advancing the birth justice work, as Jennifer mentioned. So each grantee will be required, as Jennifer said, to work on a local and state advocacy efforts, and then also identify one other priority from the following lists. So strengthen community support, supporting our birth workers, birth workforce, and improving our birthing experiences. And when you get into the application, you'll actually see where you can indicate, which priority that you would like to work on. And just really just looking to seek, we're seeking partners that are rooted in and serve Howard County residents. Additionally, partners that are, most connected and serve lower income and historically marginalized communities, and including organizations that might have not been engaged with the foundation as well. Um, so that's the opportunity. I also just want to talk a little bit about, so as Jennifer said, part of this is the grant, the work. We're not prescribing, what that work looks like. That will be determined together as a cohort, and really using just a co-creative process to think about, how you advance birth justice here in Howard County. In addition to the funding that we provide, we also have additional grantee support that we have been offering to our grantees. So co-creation is something that you're going to hear a lot. It's very different from how we've worked in the past. So you'll see, like we've been saying, that we're not funding you to do a specific thing. Together with the foundation and other grantees, you guys will work together to think about, what does birth justice look like in Howard County, and how can you make those equitable decision-making processes, or going through that decision-making process together. We also offer flexible funding to our grantees. So this is something that we've heard, as Jennifer mentioned, we went through a very intensive strategic plan process. And we also revamped our grant making just based on what we were hearing from community. So all selected grantees will be awarded an operating grant. So this means you are free to use your grant dollars in the best way that supports your organization. So it's not specifically tied to this project. It's really to be able to elevate your entire organization. So this really allows you to just have more innovation, emergent action, and just sustainability within your organization. And then the last thing I'll say, just around additional grantee support, something what we call our grantee experience. So we want to move past beyond like the grant dollars. Those are great, and we know that you need those to support your organization financially. But we also want to, what are the other supports that we can offer you as being a part of the Horizon Foundation grantee family? So all selected grantees will also participate in a collaborative learning journey with other grantees that are working across the foundation in different areas. So we have some additional grantees in the mental health space. We have some grantees in the food and nutrition space. Um, we have some housing justice grantees. So really being able to come together with all of our grantees and just help foster a greater sense of community and just a deeper learning around racial equity and organizing advocacy principles. And these principles are really, foundational to the foundation. So we've actually completed one convening earlier this winter, and we're expected to host 2 to 3 more. And so all grantees selected for this opportunity will be asked to participate in those as well. Additionally, in order for us to have a better idea of where your capacity, your racial equity capacity, your community organizing capacity is, you do ask that each grantee complete a racial equity and advocacy assessment just to be able to determine strengths and challenges. It's also a very good way to just be able to have or continue or start the conversation within your organization. So all of this is kind of used as a discussion tool. And then it really helps us to just be able to say, okay, a lot of our grantees have expressed an interest in this. Maybe we should do some trainings or some conversations or some workshops around the specific interest that you might have. And then we also just offer on-demand technical assistance, just in whatever area that might be important to you. So we have grantees that, have new boards and they're really trying to think about, how they strengthen their board, or they're trying to develop their board out more, or they're, just have a lot of fiscal questions. So, whatever is unique to your organization, we want to be a place of support to be able to help you from the foundation or connect you to other resources as well. So let's talk a little bit about how to apply. So the RFP is live now. All applications must be submitted to within our online grant system. And so you should have access to that system. Based in the RFP, there's a link for that. Um, Please ignore the second bullet. That should not be there. But this grant opportunity is really designed to help better understand your organization. So when you see the application, there will be the standard questions of, tell me about your organization, your mission, your vision, your activities. Um, but you won't see questions that, like Jennifer said, that are going to ask you, well, so what do you want to do, or what's the focus, or what's your project? The questions are going to really just be about how can we better understand your capacity, your experience, your commitment to working on complex health challenges like birth justice in Howard County. So we might ask, like, who have you partnered with, or what does birth justice mean to you, or like, what has racial equity meant to your organization, or how, or like, what type of trainings you've gone through. So this is just a way for us to be able to understand, what that looks like in your organization. There are no right or wrong answers. It's just us trying to learn more about each specific organization. Now, the deadline to submit the application is going to be May 12th. I believe that is a Tuesday. And the application typically closes at 11:59 and 59 seconds. So just make sure that you get your application in before then. Also in the RFP, you'll see that we have attached a PDF of the questions. So if you don't want to log in and complete the questions in the on the portal first, you can complete them outside the portal and then copy and paste. Or you can, whichever way is most convenient for you, but we did want you to be able to have a sense of the questions before you logged in on the portal as well. So this is just our selection process timeline. The application is open now. It'll stay open to May 12th, 2026. Then we will go through our application review period, and that will happen between May 13th to May 27th. And then notification of all award statuses will be on by May 29th. So the timeline could move faster, but this is just when you'll at least have a decision by May 29th. Um, that's all we have, but I know we want to make sure we take some time for questions. So I'm actually going to stop sharing my screen, and then I'll bring us back in gallery mode, and then we'll answer any questions that you might have. One second. Jennifer, you can start questions while I stop trying
Okay,
to. Yeah,
no
there we
problem.
go.
So I'll just open it up. Does anyone have any questions or observations, feedback? Was this helpful?
Sorry, I was trying to unmute myself. I thought it was very helpful. Thank you for the clarification. I'm just really excited to see the work that you guys are doing in Howard County and improving maternal health here in Howard County. I'm just so excited. I've seen so many initiatives, and I'm just like, really pushing for it to also come here to ensure that we are covering all the women in our area as well. So just thank you guys for this. Thank you for seeing the need and putting in the work. Thank you.
It's our pleasure. And let me add something here too, because this is funding for just 1 year, right? We know that when it comes to issues related to perinatal health, that they last longer, that they have persisted for some time, and that it can be a challenge for us to really make an impact in such a short window of time. And so while we do not have a clear sense of what our 2027, and we in our, just by as an aside, our budget or fiscal calendar is from January to December. So we're not June to July or October to September. We are January to December. When we think about our 2027 budget, um, those are conversations we usually have later this year. And so it is certainly our desire to have opportunities where there's multi-year funding. But for this particular initiative as a start, not as a finish, we want to at least see uh, what we might have to offer for 2027. And so if we have it, I think that there is a desire to see how we can continue. But right now we can't make any promises or commitments for a renewal or even a guarantee for funding in 2027. But I think that we acknowledge the need that to address these systemic issues is that it does require long-term or at least multi-year funding. And I think that based on the work that the foundation is doing with other funders and having conversations with other national funders, I think my job, now that I'm back from session, my goal is to help to identify those opportunities to collaborate with other funders so we can leverage each other's funding to help support those type of multi-year opportunities. And so we're doing our best here, but recognize that this is just a starting point for us, not that we expect that this to be it. So I just wanted to put that out there, that we acknowledge, and we heard even from our strategic planning process that there was a need amongst our previous grantees to have multi-year funding opportunities. Unfortunately, through this particular opportunity, that is not reflective of that, but I do believe that we have a commitment to ensure that we are making the appropriate strategic investments for the long term in this space. Not that anyone asked, but I just wanted to put it out there.
Thank you, Jen. Thank you, Kenitra. Hi, guys. I just wanted to say thank you as well. You guys know I've been doing the work with the health department. So I will say, now that Peace is a bit more well known, we've seen the great need in the perinatal community. I think we all know what the world is looking like right now. So, like, we've seen huge increases with housing needs, mental health, substance abuse. And I heard you, but I just want to commend you guys for even, taking on the initiative, because I think in the 3 or 4 years that I've been in Howard County, what's really missing is that collaboration. Like, to this day, I'll talk to like certain groups and they don't even know that people are struggling. When you go to northern like Howard County and you have like those affluent moms and, really doing the outreach out there. I know a lot of people don't do outreach out there, but really out there is where you raise the awareness. And I'm happy that Peace has even been reaching them, because we've had moms who make, way over the threshold, looking for doula support. Which when they learn about Peace and learn about other people struggling, like we've had people who have brought donations or created like gift baskets. So a lot of it is collaboration and letting people know like what exactly, instead of having that like ideal Howard is great, which it is, also letting them know that people are falling in the cracks. And although Peace is great, we also have, we are at a capacity as well where we're calling certain services and everybody's at capacity right now.
Yeah.
So sometimes it's, hey, I have this donation for you. Like I literally had a teen mom and she's like, I have nothing. And I'm like, well, my brother
Mm.
just had a baby boy, so I have some stuff for you. And that's how, we're working it out, or families who've experienced loss and they're looking for doula support and have, experiencing a pregnancy after loss. So I just wanted to thank you guys and also share that I finally have my determination letter for Psycho Roots. So I'm excited to be here.
Congratulations.
Yeah, and I've been doing the foundational work, so I'm just excited to like be here. It's been 2 years.
Well done. Well done.
Thank
And
you.
you mentioned something else here at your last comment, and we applaud you in securing that status. For those who may not have a 501(c)(3) status, know that there are ways to apply. And Kenitra, I don't know if you would like to elevate that. You can probably share more because I don't want to mess up here. But we do uh, welcome for those that need it fiscal sponsorship for you to explore that, and I think we can provide some additional insights on that too if you are looking to identify a fiscal sponsor or need a fiscal sponsor. But we do there are other ways to apply. So Kenitra, do you want to
Yeah,
chime in on that while I open the
we
door?
can definitely accept fiscal sponsors. In the app, if you are applying with the fiscal sponsor, we ask that you put the application under the fiscal sponsor's name, but all of the questions that you answer can be, based on your organization. But it's just easier for us to track in the long run, just to have the fiscal sponsor name. And if you apply under a fiscal sponsor, just send me a message because that'd be helpful for me. But you could like put this fiscal sponsor's name and then in parentheses say fiscal sponsor for whatever your organization's name is. And then um, there's like more considerations in terms of funding. Like, well, like if you receive a grant from us, we'll have the fiscal sponsor and your organization sign the grant agreement. And of course, the installments go to the fiscal sponsor. So all things that we can work through. But if you have any questions and need to go that route, just send me an email directly and I can help you.
Anything else? Y'all quiet.
Real quiet.
Hi, I have a question about eligibility. I'm from Johns Hopkins Center for Communication Programs, and our domestic team does a lot of work we're the lead communication partner for Be More for Healthy Babies, and we do some very relevant work, I think. I was wondering if there's like eligibility criteria around location, if you're looking for applicants who are based in Howard County, or if you're open to applicants who are based in Maryland in general. Thank you. And thank you for all of the information as well.
Well, thank you, Lindsay, for joining. It is a pleasure to have you here. I appreciate your question, and that has been one of the common or the frequently asked questions, I should say. And so it is our goal because we are a Howard County uh, foundation where we are rooted and where we serve. This opportunity is really for organizations who are also rooted and have a base here in Howard County. Um, we really would I would we really want to prioritize organizations that are based here and who have been doing the work here and to ensure that they have the opportunity to be considered. And I would say it is preferred. If there are other organizations that fall outside of Howard County, but are looking to maybe partner with others or have resources that could very well be leveraged in supporting our Howard County based applicants, I think that is welcome. I think one of the things that was recently mentioned was around collaboration and co-creation. And so organizations are welcome to come together and to submit a joint application if that's desired. But I really want to elevate the importance of us ensuring that that this is an opportunity that is for those who are based and rooted and have a constituency here in Howard that serve Howard.
Great, thank you.
No problem. Any other questions? Okay. Well, I will stop there. We'll stop there. I know Kenitra will put back up our contact information if there is anything at all. As I always like to say, all hearts and minds are clear. But if there is anything that else that comes up for you, any questions, comments, feedback, concerns, I think please do not hesitate to contact us. I will say that when it comes to our RFPs and how we do things, we really don't like to be prescriptive. We really want this to be a collaborative and co-creative process, and to ensure that we're working together to create the impact that we desire to see here in Howard County. And our application is really looking at fit. How well do we work together and ensuring that that this can be as we say, a harmonious relationship, and where our goals and our values are aligned. And so that's what we're looking for. That's what we're reading for. And again, looking forward to building new relationships here in Howard as well. So, Kenitra, any other words or
Yeah,
last?
I dropped our contact information in the chat. It's also in the RFP, and contact us anytime. So we're also different. And if you have a question, if you need to think through something, like contact contact Jennifer. Like she can help with content, things like that. But hey, Riley. And then if you have any questions, just any issues with the the grant portal or anything, feel free to contact me or contact one of us, and we'll get you whatever you need. So our job is really just to be able to be to support you guys. So just let us know how we can help, and we will do so. And we'll post the slides and the recording online. So if you want to share this with anybody that you know that couldn't make it, or if you want to just refer back to anything, we'll have that posted where the RFP is listed as well.
Mm-hmm.
Thanks so much.
Thank
We look
you.
forward
Thank
to
you.
getting you guys applications. Thank you.
Thank
Have a
you.
good evening.
Thank you.
Take care, everyone.
In the recording. All right.